since the onset of the pandemic. The move follows last month's announcement.
Reverend Johnson's on the line.
Pastor Johnson, how are you?
Travel for the vaccinated.
I am well, Sandy. How are you?
I'm doing well, thank you. Hold on one moment, please. I've just got to finish reading this.
Reports the House gave final approval last night, but it wasn't pretty.
Before the party line vote, the acrimony between Democrats and Republicans was on full display. House Speaker Nancy Pelosi scolded Republicans.
Let us remember this should not be controversial. The debt limit has been a long-time bipartisan issue.
Republican Michelle Fischbach fired back.
The last 5 times Republicans controlled the House, Senate, and the White House, the current Speaker and the entire current Democratic leadership only voted to raise the debt limit one time.
The $480 billion increase in the federal borrowing ceiling is a stopgap, and Congress will have to revisit the issue in December.
Notice those higher prices for a lot of things you buy? The White House says it has helped broker an agreement it hopes will help relieve supply chain bottlenecks that are driving prices higher. We'll hear more about it today. San Francisco's struggling with widespread organized shoplifting. Now Walgreens says it will close 5 more stores in San Francisco because of the shoplifting. Actor William Shatner rockets into space today with the space travel company Blue Origin. This is AP News. Retirees can expect bigger Social Security checks next year.
Rising inflation is expected to result in a sizable increase in Social Security's annual cost of living adjustment, or COLA, for 2022. The exact amount will be revealed later today. Over the last 10 years, the Social Security adjustment has averaged about 1.7% annually as inflation remained low. But the economic recovery from the coronavirus pandemic has triggered rising prices for a wide range of goods and services. The Great Recession saw a COLA increase of 5.8% for 2009. The number for next year may rival that. Mike Hemp in Washington.
Employers are struggling to find workers. Now UPS says it'll hire in 30 minutes or less. Taking too long to hire can mean an applicant may go elsewhere. UPS is pretty much doing away with interviews. I'm Rita Foley, AP News.
One of my guests today had piece just came up in The Guardian. And so I had to finish reading it.
We are Chicago's most progressive talk, where facts matter.
Paul?
Now, your WCPT 820
Paul?
Chicago traffic update.
On I-80 between Harlem
Paul?
and Park Avenue, emergency crews have...
Yes.
Hi, when you get up, Mr. Patillo, would you bring him up early, please? Because I want to ask him something, okay?
Okay.
Thank you so much.
Street and I-65 eastbound traffic's been heavy in East Chicago. On the inbound Eisenhower, it's your time for now.
Oh, boy. Okay.
5 minutes.
So here we are. Here we are. Oh, boy.
14 minutes, 95th to downtown. Congestion. Inbound Bishop 4 traffic sites, 111. 13 minutes, 80-94 Converge.
I'm Hartman.
Donald Trump made being a psychopath fashionable. He made it acceptable. And his neurological tribe of psychopaths are like, and as a consequence of this, people who have Biden-Harris stickers on their cars or a pride flag in their window are facing vandalism, arson, and worse.
The Tom Hartman radio program. Weekdays 11 a.m. to 2 p.m. on WCPT 820. Where if you're living with diabetes and using insulin, you know the pain of clicking your fingers over and over again by wearing a small...
Hey, everybody. How you doing? Hey, Renato. We see Dave and Andre and Linda. I've got Pastor Vicki Johnson on with us. She's going to be giving us some good news today. Hope you all are doing well. Everybody, when you can, please, hey, Abraham, my sweet, when you can, please go over to the Santita Jackson Show channel on YouTube. We really want you to start watching the show from there, from that platform. So everybody, Abraham and Joyce, if you have the capacity, please go over to the Santita Jackson Show channel on YouTube and watch the show over there, okay? Francis and Linda and Michael and
30.
and thank you so much. And Kenneth and Renato, where are you, Renato? Are you down in Brazil? Looks your name looks Portuguese to me. And Jewel and Linda, and I'm repeating, and Philip and Kenneth D. Good to be with you today. We're going to be talking about Kyrie Irving and vaccine hesitancy and how some of these players might be used politically, not just by the right, but by the left. Stay right there.
This is the Santita Jackson Show.
Determined, unstoppable, achieving the impossible. We're standing tall with our heads held high. We are victorious.
Hey, everybody. Welcome to the Santita Jackson Show. It's Wednesday, October 13th, 2021. I'm Santita Jackson, coming to you from WCPT, the nation's largest progressive talk radio station, and AM 950 radio in Minneapolis, St. Paul, the voice of progressive Minnesota. Yes, the whole state. I want to hear your voices today. You all have been calling in. I'm so happy about that. 773-763-9278, 773-763. WCPT. If you want to text me, GWC Injury Lawyers gives you that opportunity. Want to hear your voices, though. 773-763-9278. We're going to be talking about the NBA players with an NBA veteran, Atan Thomas, brilliant writer and author and thinker. We're going to be talking about the players who are holding out on the vaccine or who are just refusing to get it. Kyrie Irving is probably the most prominent amongst them. And it averages out to one player per team, but the media have focused on the NBA players without focusing on the firemen and women and the police men and women who are refusing to get the shot. They're among the most vaccine hesitant. Now, it is your business to do whatever it is that you feel compelled to do. But it's just kind of interesting how all of this is rolling out. And we're going to be talking with Dr. Deborah Holden and Dr. Shanita Knighton about creating a safe workplace in the health space in COVID-19. Because there are a lot of nurses who are now saying all over the country, hey, wait a minute, this hospital is not clean. My workspace is not clean. Now, as things are being mandated, what else do we need to mandate, everybody? What else do we need to mandate? What else do we need to take care of? Got a lot to talk about and some questions for her about now how these therapeutics are being handled. So let's get right to it, everybody. As we get to these headlines, the Sox are out of contention for the World Series. Yes, they fell to the Astros yesterday. Wow. Astros 10, Sox 1. But you know what? Let us all pay tribute to the White Sox, because guess what they did? They got real far, you guys. They got real far. I am so proud of our White Sox. Our White Sox. God bless them. And the Astros, well, I hope they will carry the banner and do great things as they move forward. So everybody, the White Sox. Okay, in Chicago, we're going to have a high of 71 degrees today. It will be mostly cloudy. Minneapolis, St. Paul, 63 degrees, thunderstorms. The Dow closed down 117 points yesterday. The NASDAQ closed down 20 points. The S&P 500 closed down 10 points. And the White Sox, well, NHL, that's right, hockey is upon us, and the Blackhawks will be playing the Avalanche today. And this is that rare time of year when everything is at play. I love it, everybody. Coronavirus cases, according to the CNN report, are declining in the United States, but the number of new infections in children remains exceptionally high, with 148,222 cases reported in the week ending October 7th. We're going to ask Dr. Deborah Holden about that. What can we do to protect our children? Of course, Dr. Shanita Knighton will be talking with us about that as well. The House of Representatives approved an extension of the nation's debt limit through December after the Senate passed the stopgap measure last week in a bid to avert a catastrophic default and economic disaster. Everybody, what do you think? What do you think about that? All right, let's get to this. William Shatner, that's right, Captain Kirk, 90 years of age. Can you believe this? He is going to space today. He will be the oldest person to be in, well, near outer space. It's not outer space, but inner space. It's a big, big thing. He says that he is a little frightened, but you know what? We know that he's going to do it. The veteran actor who spent 4 decades playing the fearless commander of Star Trek's USS Enterprise is headed for a real-life leap into the stars today on the next stage of billionaire Jeff Bezos' quest to dominate the fledgling space tourism industry. Hey, if you could take one of these flights, would you? Call me, 773-763 WCPT, 773-763-9278. Everybody like and share. And if you can, please go over to the Santita Jackson Show channel on YouTube and view the show from there. Therapeutics nationalism, that's what some people are calling it. The poor are at risk of being left behind as rich nations are buying up the new COVID drug from Merck that cuts hospitalizations by 50%, according to the latest studies, okay? The same day Merck announced the results of the trial, the New York Times reported that the Biden administration placed advance orders for 1.7 million courses of treatment at a price of $700 per patient. Now, everybody, this is a 4,000% markup from the cost of production. We've been talking about this. 4,000% markup. How does that happen? Well, I mean, America is not alone because guess what? Australia, Singapore, Malaysia, and Thailand have followed the U.S. and they've already secured this drug from Merck, and they have started talks to obtain the drug. So, what do you think about that? What do you think about that? Them that's got shall get, and them that's not shall lose. Everybody. Bernie Sanders is saying, hold on. He and Pramila Jayapal, Congresswoman who's head of the Progressive Caucus, is saying that Medicare expansion in this reconciliation bill, the $3.5 trillion bill, they said it's a non-negotiable, it's a non-starter. Now, mind you, Joe Manchin wants to eliminate some key provisions. They're saying we're not going to eliminate them. I hope they hold on. They have a 96 vote block in Congress. You've never had progressives have this many numbers and this much power before in the modern era of American politics, at the very least. So we will see. In the meantime, there was a rally on Capitol Hill led by Reverend William Barber of the Poor People's Campaign. And they're speaking on behalf of essential low-wage workers who are saying that we need the reconciliation package. Everybody, you need to call 202-224-3121, 202-224-3121 if you think the reconciliation package needs to be passed. That is 2 years, free community college, people who need to be retrained for their jobs. All of that would be free. Paid medical and child care leave. Think about that. Call and make it happen. Southwest Airlines is still canceling their flights, everybody. And their pilot said that the airline's weekend meltdown reflected long-running fatigue and frustration among crew, everybody. Their troubles last week, there were 800 flights, more than 800 flights canceled on Saturday, more than 1,000 canceled on Sunday. And they're still canceling flights. What do you think is going on? Some people are saying that it's the vaccine mandates. Their union, the Pilots Association, which represents Southwest 9,000 pilots, has blamed the airline's management and what it describes as poor planning for the trouble. We're going to continue to follow that story because it is creating a lot of havoc in the air. In the meantime, a record 4.3 million workers quit their jobs in August, led by food and retail industries. 50% of workers in the United States want to make a career change. What do you think about that, everybody? And many of these young workers want to go into farming. Wow. Let me go to you, Pastor Vicki Johnson. So much is changing so rapidly. Wow. I mean, you've got 4.3 million, 4 million left the month before. People are leaving the workforce, but I'm wondering, is it just because of job dissatisfaction? Or is it, I think it's a mixture of things, job dissatisfaction, vaccine mandates, a lot of things are happening, everybody. But that means a lot of people don't have health insurance in a pandemic. It means a lot of people don't have a salary, as in New York City, gas is $5 a gallon, for example. Wow. Pastor Vicki Johnson holding these safe services, everybody, from 11:45 to 12:15 every Sunday on 80th and Jeffrey, 80th and Jeffrey here on the south side of Chicago, everybody. And of course, she is the pastor of the St. Thomas Lutheran Church. Get on over there. Many of you are getting on over there, so we're glad to know that because she is a brilliant, brilliant, and anointed pastor and psalmist. What's the good news, Pastor Johnson?
Well, good morning, Santita, and all of your stars and friends. There is good news. When I was a little girl, my mother always thought someone was going to kidnap me. You see, they had shown rich and famous kids on television on the news being kidnapped for large ransoms. That should have calmed my mother's mind since we were not people of means, but it didn't. So she taught me what to do if anyone ever tried to kidnap me. To scream to the top of my lungs, that was my survival tactic. I am a swimmer, just like your mother. And when learning how to swim at the Don Nash Chicago Park District, they taught us that if we were ever in distress and you were in the shallow water, just stand up. It sounds simple, but when you're in distress, you don't think unless you've been programmed to think. And then if you are in the deep, then just roll over on your back to recover. This is water survival tactics. In life, we find ourselves in distressing situations, and if we don't have survival tactics, they can very well take us under. Although I was never kidnapped, I'm glad my mother cared enough for me to equip me for danger. I've caught water while swimming, but in my panicking moment, I remembered to roll over on my back until I could get myself together. What is your survival tactic? What are you equipped with to protect you from danger? I'm sure you have some and that you could share them with us. October is Mental Health Awareness Month in addition to many other things. If you have a toothache, you go to the dentist. If you have chest pains, you go to the cardiologist. If you have cataracts or blurred vision, you go to the ophthalmologist. When you feel out of touch with God, you go to your pastor. But when you are stressed, and in these days, many of us are, many times you either play it off or try to pray it off. Stress kills when it really doesn't have to. What can you do in some stressing situations? Well, you can go for a walk. You can learn some new breathing techniques. You can develop routines that work for you. You can put your phone down and give your brain a break. You can know what pushes your button and then navigate accordingly. And most of all, you can seek help. It's all around you. Professional help. And there's no shame in it. Proverbs 4:7 says, wisdom is the principal thing. Therefore, get wisdom. And with all thy getting, get understanding. Understand this. Take care of yourself. Understand this. Get and use tactics that work. And understand this. If you are stressed out, then get help. It's there for you. If you can do this, and I believe that you can, then to me, that's good news.
Amen, amen, amen. And how true, because that is something, you know, when you break your arm, you run to the emergency room. Break your leg, you run to the emergency room. But when we're feeling really vulnerable mentally, when we're crying, when we are exhibiting all the signs of depression, Pastor, we just don't go get the help that we need. And I would say that's especially true in the Black community because it's a sign of weakness
Most
because we've had
definitely.
to survive, right?
Yeah.
Showing weakness would get you killed. So, and that's a very real part of our experience. And
Yeah.
thank you for that because and do you think just very quickly, do you think that you need to find the tactics that work for you? Like you said, in shallow water, this is what I do. Different people have
Hmm.
different ways of surviving, of course, presuming that it's a healthful way of surviving. Do you think you need to find what really works for you?
Oh, yes, you definitely need to tailor it to you because we're all different and our experiences are different. But we also, sometimes we can't do that. So we need somebody to help to see us from the outside that can pinpoint some ways that we can manage and maneuver through our lives. And that's through therapy. A therapist, I think, is a great thing.
Pastor Vicki Johnson, 80th and Jeffrey, everybody. You are still, are you going to be moving indoors anytime soon?
Yeah, I think that November is going to call us indoors, but God has really smiled on us, shined on us literally with great weather. Even through October, it's yet supposed to be great. So we're going to stay outside as long as we can, but when we go inside, we will be spaced and we will yet be masked and the services will yet be a half an hour so that we're not so comfortable in that space that we forget that we are yet in a pandemic.
Okay. So that's why you went to a 30-minute service.
That's right.
Okay. To limit the exposure that people have to each other. Well, it's
That's
80th.
right.
Thank you for that. That's very smart. Very smart. 80th and Jeffrey, everybody. And some of you have dropped by there. And so please go on and get out and support this wonderful ministry. I mean, she's one of the few women in the United States who has her own pulpit, the St. Thomas Lutheran Church. And I hope you can hear her sing too, because don't die before you do that. She's one of the greats. One of the greats. Pastor Vicki Johnson, everybody. St. Thomas Lutheran Church at 80th and Jeffrey from 11:45 to 12:15 on Sunday. Get on over there for that half hour of power. Sending you much love, Pastor Vicki Johnson. We've got Dr. Deborah Holden, noted epidemiologist, world-renowned epidemiologist. Indeed, she comes out of Johns Hopkins University. They brought her to the School of Medicine at Michigan State University to build their School of Public Health. She is the Associate Dean for Public Health, and so we're honored to have her every morning helping us to get, empowered. Knowledge is power, everybody. Dr. Deborah Holden, knowledge is power, and knowledge is empowering, and I want to thank you for giving us so much comfort because we've needed that at this time. We're hearing a lot of talk about this new pill from Merck, this therapeutic, which is where they said they were going. They said, we're not going to do vaccines. We can't come up with a vaccine that is as effective as we would like it to be if we're going to put our names on it. So that's fair. And they've come up with a therapeutic that is supposed to cut hospitalization in half once you have COVID. That's very promising. That having been said, it turns out we're seeing the same thing happen with this pill, Dr. Verholden, that's happened with the vaccine. The rich nations are buying them up. The United States has already bought 1.7 million doses with a 4,000% markup. There are a couple of things I want you to unpack here. The United States, why does our government buy these doses from these pharmaceutical companies?
I'm not sure I understand the question. What do you mean?
Well, my thing is, if these are private companies, should they not just sell them on the open market? Why does our government have to buy them?
Well, the government is buying them so that they come to us at no cost.
Okay.
Right? Or at some kind of reduced cost. But yeah, I'm just trying to make sure I'm understanding the question that you're asking.
That is it. That is it. Because we're seeing the government, and then they bought it at a 4,000% markup. Could they have done better than that? Should they have negotiated something far less expensive than a 4,000% markup? How is that justified?
Yeah, well, I mean, this is what our marketplace looks like. You know, things are marked up at ridiculous prices, and companies get to set their own pricing. That stuff is not regulated. You know, the kinds of things and the kind of costs where we do have regulations has been hard to get around energy and you know, other types of, you know, vital services. So, you know, this is unfortunately just how things work. And it's not our first rodeo. This is not the first time that we've seen life-saving medication cost an arm and a leg and be cost prohibitive, not just for individuals, but for entire nations.
See, you know,
So,
and
yeah, that's just unfortunately how it works.
and that becomes my question, because the government is supposed to be watching out for me, right? And if they're going to agree to buy something from a private company that we gave them the money to develop, okay, and they buy it at a 4,000% markup, that just doesn't make sense to me. Well, I'm missing this. You know, it costs $17 to make it, but it's going to cost more than $700 to purchase it. And if as we're seeing 4.3 million Americans this past month leave their jobs, 4 million before. Now, I don't think they just dropped out of their jobs because they want to see something else. You got vaccine mandates. You got a lot of stuff going on, Dr. Verholden. It's just unsettling. Well, maybe this is what we need to see. We need to see this is the sausage making, right? It's never really pleasant. Never really pleasant. And they're calling it therapeutics nationalism. What is the danger? I've got really one and a half minutes before we go to break. Is there a danger in rich nations having all of the therapeutics and the vaccines, of the lion's share of them, and poor nations going without in this pandemic? Is that dangerous?
We're gonna ultimately pay a price for the global inequity, and the way that that's going to happen is people are going to travel and move about, and the likelihood of you coming in contact with somebody who is, you know, positive for the virus will go up. When you're in places where they don't have ready access to vaccines. So we will ultimately, and I've been trying to take on different examples, even in our own country, of where inequity costs everybody, you know, and we've seen that in some of the cities across the U.S. where early on in the pandemic, you know, certain people just were forced to work. Those cities did worse. Most of the excess exposure that we saw in minority populations was due to occupational exposure, because they just simply didn't have the luxury to shelter in place and to switch their job over to Zoom. You know what I mean? If you don't have that type of job, you know, if you were driving Uber, if you were an orderly at a hospital,
absolutely,
if you were a grocery, you know, worked in a grocery retail store,
yeah,
you have the option to no
people
PTO,
on the front
no,
line. They were not protected.
Yep.
We're going to be talking about keeping our workplaces safe, particularly in the healthcare space. Back in just a minute on the Santita Jackson Show. I'm sorry, I wasn't trying to throw you a curve, but you know, just as I read more and more about the drug, the 4,000% markup, I mean, because no one is saying that enough. And I said, well, wait a minute, you know, it seems to me that, you know, we're seeing these private corporations really, they are really lifted up. They really get government contracts. I mean, that's really what it comes down to. I mean, they really get tremendous government assistance, and then they're able to profit privately from, you know, Americans' money. And then Americans have to pay for it. There's just something about that that's just not right, Dr. Deb. It's just, it's not right. It's not right. And as you continue to point out, as people don't have jobs, they do not have health care. So they won't be able to afford that pill. If they can get it, if they can get access to it, that's another piece. So
I told you, it always reminds me of the scene in Friday where Craig loses his job and then he asks his mother to borrow $500. And she said, well, I wouldn't feel comfortable loaning you $500 without a job. And he said, well, if I had a job, I wouldn't need the loan. And she said, exactly.
Oh, my gosh.
It's like a really, really weird circular argument, right?
It's crazy.
It's like, well, I wouldn't need support for, health insurance if I had a job or if we had a system where my health insurance wasn't linked to my employment.
Mm-hmm.
I don't think anybody would just choose to not have health insurance.
It's a whole lot for people to quit their jobs. Yeah, it's a whole lot. So it's not just people, oh my goodness, I want to live life differently. No vaccine mandates. You're beginning to see a lot of things that are being impacted. And and I think that we are going to have to unpack this and not come up with some with answers that really are not necessarily, that ain't necessarily so, as the song would say. I mean, and that's what when I heard the speculation on the news this morning and yesterday, they were like, well, people want something better. I said, yeah. People are also being forced out of their jobs in big numbers. Yeah. And that is going to be problematic, and even we're going to have Atan Thomas on with us a little bit later. Atan is a retired
Dr.
NBA.
Knighton on the line.
Thank you so much. We have Dr. Knighton with us. He's a retired NBA player. And, it's interesting to see the focus. More than 90% of the NBA are vaccinated. They've gotten the shots. And we're focusing on them, but we're not looking at the police. We're not looking at the fire departments. They are pushing back against it. We're not even looking at the nurses. We're not looking at that, no. And, I can hear something in the background. Okay, so Dr. Knighton.
And we have Attorney Hoffler.
And Attorney Hoffler.
How are you?
Okay. You all asked for Attorney Hoffler. We got Attorney Hoffler. So all the legal questions that I cannot answer, she
Hi.
answer.
Hey. I'm always so honored to be extraordinary professionals lead the way. When I talk about you all outside of your presence, I say how you all are the most
back in 30.
And I put Santita in there, of course, as well. Brilliant people in the world. And I say, and they just happen to be women, and they just happen to be Black. And I don't even, Dr. Deborah and Dr. Knighton, if you hear people say, oh, I heard that you have international prominence, it's because I have talked about y'all so much. And all I don't know, y'all may be running the world, everything, everywhere. Oh,
love it. But stay right there. Hold on.
To be able to promote talent.
Hey, Keith.
This is the Santita Jackson Show.
Determined, unstoppable, achieving the impossible. We're standing tall with our heads held high. We are victorious.
Hey, everybody. Welcome back to the Santita Jackson Show. It's Wednesday, October 13th, 2021. At the top of the hour, we're going to be talking about the NBA vaccine holdouts. What is going on with that? Are they being used politically by the right, by the left? Got to talk about that with Atan Thomas. Of course, he is an NBA veteran, has been with the Washington Wizards, the Oklahoma City Thunder, and the Atlanta Hawks. And now he is a best-selling author and poet and motivational speaker. We cannot wait to hear from him. And of course, Attorney C.K. Hoffler will be joining us because there are a lot of legal implications, and that's why we have her here with us this morning, joining Dr. Deborah Furholden and Dr. Shanina Knighton. Because Dr. Knighton and Dr. Furholden would say, we need CK here because these are legal issues now. And increasingly, health, we're seeing the intersection, Dr. Deborah Furholden. Dr. Knighton, thank you so much for joining us. Registered nurse, a research clinical scholar from Case Western Reserve University, infection preventionist, one of about 5,000 in the United States. There are 331 million of us. Think about that, everybody, just in the United States alone. And Attorney C.K. Hoffler, immediate past president of the National Bar Association and chair of Rainbow Push, brilliant attorney. Dr. Deborah Furholden, it seems that in this healthcare space, we are beginning to see, it's always existed, but we're seeing the intersection of politics. We're seeing the money in this, and we're seeing law. I mean, more and more. Where do you think Where do you think, particularly as we're seeing more and more people who are leaving their jobs or who are being fired from their jobs, uh, and as we're looking at people who say, I'm not going to take a vaccine because I can't sue anybody. you know, wow. I mean, I didn't realize that all of these. It seems like there's no part of our lives that the healthcare system doesn't touch. As we go into 2022, where do you want to see this healthcare discussion go? Where do you think it needs to go so that we can move toward equity, which has been your fight?
Well, and the key for me, my movement is to mandate equity. And it's funny because people say, well, do you want them to mandate the vaccine? I said, I have never said mandate the vaccine. I've only ever said mandate equity. And when I say mandate equity, what I mean is to use whatever legislative and other authority that exists to ensure that there's equity. And our biggest authority in this country are the laws. And then the second and critical piece of the laws are the enforcement of those laws. And so the call to action is for legislators to make good laws for equity and for health equity, and for the executives to enforce those laws. And we have so many missed opportunities. We have good laws on the books that don't have enforcement, and we have some obvious places where we should have had laws or policies where we don't. So I really still am at a complete loss how we've gone the whole pandemic without a national mask mandate. And now we're seeing vaccine mandates. It makes absolutely no sense to me. And watch this, because even if you're vaccinated, unmasked, you very much could be contributing, and likely are contributing to spread. So it's the folks that we've entrusted aren't doing what they're supposed to be doing. Why are you mandating vaccines and we haven't never had a national mask mandate? Yeah, so that's what I'm pushing for. Where are the laws and the lawmakers, and where are the laws for equity? And then what is going to be our strategy to enforce those laws?
Well, and since they're telling me to follow the science, I mean, I'm wondering, is this about science or compliance? Because they're not telling people, when you tell people who are vaccinated and unmasked, and you even ask them very gently if you can put your mask on, they will look at you and say, I'm vaccinated. I mean, I hear that all the time.
It's hypocritical. This follow the science is hypocritical because our leaders aren't even following the science. They're not following the science. They're jumping out in front of the science. Anytime the president and his office is talking about when people should be getting boosters and blah, 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 without that having been FDA approved, without a recommendation from the CDC, they're politicians. Like, everybody is out of their lane. And follow the science sounds good, right? Because it makes us think it's something better than what the previous administration did. But it actually looks very much, if I was a fly on the wall watching, it looks very much the same to me. Not much has changed, in my opinion, over the course of this pandemic. What we've seen is politics have been at the forefront and been driving the conversation and the actions, and public health and science have absolutely been. I feel like we're in the back like these little ants with these little teeny tiny megaphones, all huddled around. And then there's this big giant who just controls the whole narrative that's out in front of us, and literally at any moment will just step back and squash us. So yeah, this has not been about health or public health. It has definitely been about politics and political meddling, and people with political power misusing that power for their own gain. I don't understand how people, for example, in Florida are not up in arms. I don't understand, given all the deaths that they've had, those deaths have hit home. Those deaths have to include people's spouses and children and grandparents and aunts and neighbors and all of that. How do they reconcile that for themselves? And what are they saying to themselves about the elected leaders that they put in place, that more than half of them still stand behind, with all of the death that, to me, is on the hands of the leaders who didn't put the laws in place to protect people?
Well, I think it's the depth. I think you're seeing the depth of the mistrust and the distrust. That's what happens.
Sure.
And when you have people who have, they've not just botched the message. They tell you to follow the science, but they're not telling you that even when you've been vaccinated, I mean, you hear different stories from all the people who are in authority. And we were told for a year, don't wear a mask, knowing full well that we needed them. I mean, and what we're here to do here, look,
I
we
didn't
can,
tell y'all that. I
no,
didn't
you
tell you. I
didn't.
told you from day
That
one
came
that
from
we're a
DC.
man.
That's right. That came from DC. And we saw that not only said to us, but it was acted out every day. So, so the thing is, but we're not here, we can't relitigate that. And we can't do a do-over on that. What we can do is move forward and get this stuff right. Because this is a lot. But you know what? I was reading this, and I want to direct this to Dr. Knighton, because you are a nurse. We have nurses down in Asheville, North Carolina, who are saying that, look, wait a minute, our environment is not safe. We have lax COVID-19 measures. What is going on? They said, the way they leave patients out here, if they're on gurneys, we don't feel safe in the hospital or the healthcare space.
I agree. I couldn't agree more. One of the big issues that we have is that it was unsafe even before the pandemic. Okay. Meaning that we were already faced in a situation where we had staffing shortages. We also had potentially inadequate equipment. And even right now in the state of Ohio, mandatory overtime is something that has been up for debate, meaning that we are trying to get them to eliminate it, because it is unethical when I've worked 8 hours and I'm expected to work an additional 8 unexpectedly. So when you when you don't have the correct equipment, when you don't have the correct resources, it puts you in a situation of where you are having to make decisions that potentially can put your license on the line. And your employer cannot guarantee that you have protection should any of these things unsafely happen. We also know, too, that some of the quality measures have been relaxed because of the pandemic. So they're actually using their emergency, how can I put it? They're using they put the emergency cards, which means that typical things that would be deemed by the CMS, which is Center for Medicaid and Medicare Services, or the Joint Commission, which are accredited bodies that make sure that hospitals do what they're supposed to do. A lot of their guidelines have been relaxed because of the pandemic, because they realize that some hospitals are operating with staffing shortages, with inadequate equipment. So these are things that we're facing right now that many people aren't thinking of. Even something as simple as the break rooms. Like, there's been plenty of studies that have come out about the break rooms being a vector, or not a vector, but being a petri dish for COVID. Meaning that a nurse may go into a break room or into the dictation room to eat their lunch or to be able to give report, and you're at risk, of getting COVID, potentially because it might have fell on some, the keys or a mouse that maybe you have to touch that someone else touched, and you might be cleaning things, but if you're trying to hurry up and rush in between patients for whatever reason, you're putting yourself at risk trying to take care of those individuals. And so with that being said, does that mean that they don't have adequate cleaning staff to make sure that these items are cleaned in between? So there are numerous amount of issues right now when it comes to safety, including the fact that some of your own coworkers may not even wear their mask properly and were not cleaning their hands correctly even prior to the pandemic, which is what my profession, exists for. Like, we exist to be able to correct practices to prevent healthcare-associated infections. And it is because something as simple as hand hygiene is still lower. We have still low compliance rates, even to this day, even though these are life-saving measures for healthcare workers, but most importantly for our patients.
Unbelievable. I mean, Attorney Hoffler, do these nurses have any recourse?
So your question is, do the nurses have any recourse? The ones who are not.
Because, let me just say this. We have a lot of mandates. Dr. Verholden, you just heard her frustration. She said, wait a minute, we don't even mandate masks, but we're mandating vaccines, okay? It's just uneven. We're mandating a lot of things for workers to do in the workplace, but no one's mandating a clean workplace.
Absolutely. So, I'm sorry. Dr. Knight?
Oh, no, I was just going to, and I'm so happy that you're here. So I'm going to let you talk because I've been asking about you. I'm like, where's this brilliant brain at? So I want you to answer and then I'll say.
Well,
so
no,
what I
but then
gotta
you know
say
what,
for me-
Dr. Knight, and you take over here. What do you want to ask her? You go on because you have been talking about her all week. Weeks.
I have, and so I was explaining to Santita, one of the biggest issues that I have right now is that we do have a lot of mandations that are coming out. But when we talk about, let's say, OSHA, right? So OSHA actually has it in their guidelines that if facilities are mandating certain things in their employees, that they should actually be providing a personal protective equipment for them to be able to use. But the question then comes is, how would employees know that you actually, if they haven't written any guidelines, and let's say there's just signs up and saying that, hey, we're getting ready to do this. There are no, I would say, standard operating procedures in place in regards to how to use the personal protective equipment. And let's say, for example, when someone violates it, there is no accountability when it comes to that, but yet it may put someone in at stake. So that's my first question. And then the next question I'm going to ask about surveillance and reporting measures, which a lot of workplaces are neglecting to put in place as well.
Okay, well, that's a whole lot. But first of all, good morning, everyone. Good morning. And this is what we have to remember when we're talking about COVID and the legal structure. And I want to set the table, the legal table, because all the questions that Dr. Knighton is asking, and Santita, the questions that you're asking, have to fall within this legal framework. One, and I want to just focus on 3 legal frameworks. The first one is President Biden's COVID-19 action plan. And we know, and Dr. Knight just spoke of OSHA, which is the federal agency that really recommends, typically recommend, and if we look at healthcare workers, because let's go straight to the issue that Dr. Knight pointed out, who have exposure or who are suspected to have exposure and to COVID-19 based on parents. They do have, not based on parents, based on patients. They do have certain guidelines, general guidelines, but the question is, are those guidelines well known and do they make sense? President Biden has unleashed this COVID-19 action plan where basically all employers that have a workplace of 100 or more employees can mandate that the employees be fully vaccinated. They can also mandate that things such as weekly testing for those who are unvaccinated, because remember, there are some exceptions. The EEOC, which is another legal entity that we have to look at. We've got the president with his action plan that says, yes, all employers can mandate that their employees be tested. The EEOC gives us guidelines and says, yes, but there have to be these exceptions carved out. You've got the religious exception, and you've got medical necessity or disability exception. So, and what I'm saying is this is a complicated legal framework that most lawyers don't understand, but I digress. So we've got President's Action Plan. We've got the EEOC guidance that's saying, yes, you have to have mandates, but you got to carve out these 2 exceptions, which in many instances are difficult to enforce because now they're talking about sincerely held religious beliefs. Well, what in the world does that mean? If you have a religious belief, what do you mean sincerely held? They're not sincerely held for one person. So when you have these subjective elements that are injected into a determination as to whether someone cannot be required to take a COVID vaccination for religious beliefs, there's too much subjectivity in their mind impression. And that's why there's litigation over this. So you've got the president, you've got the EEOC, you've got OSHA. The president has tasked OSHA with putting in place requirements for what is safe in the workplace. And that goes to Dr. Knighton's point. When you've got nurses, if you don't have, and also Dr. Verholden, if you don't have widespread mask mandates, what are we talking about in terms of safety? I think there's a disconnect between the political realities, the need to have as many people in this country vaccinated and the implementation of that. In reality, you can't just have vaccination without other measures, masks, appropriate hand sanitizing, social distancing. People keep on forgetting about social distancing. And then if someone is vaccinated, there has to be, as Dr. Verholden has said, there has to be implementation of you still need to wear a mask. You then have to look at the CDC guidelines, which to me are all over the place. So you've got the President's Action Plan, you've got the EEOC guides, then you've got to look at the CDC's guidelines, which change every single day. I monitor them every single day through something new and confusing to me as a practitioner who analyzes laws and regulations and rules. So you have those three legal structures. Then you have what the state and local governments do. And sometimes they are in complete conflict with each other. For example, here in Atlanta, our mayor did impose a mask mandate. I believe in Chicago, there was a mask mandate. Our mayor was being sued by our governor who did not believe there should be mask mandates. In Texas, you see similar, I don't want to say craziness, similar inconsistencies where you can have the governor saying, no, we don't believe in mask mandates. And then you might have other entities, localities that are saying, we're going to impose mask mandates. So then there's litigation surrounding that. So when you are an employer and when you're an employee, when you are the least of these just trying to survive, you don't know whether you're coming or going. Because one, you can't sue. Let's just be clear. You cannot sue Pfizer, Moderna, those who have manufactured this vaccine if something's wrong for any unintentional consequences. But let me just say this, ladies and gentlemen. If there is ever any evidence, just like with the tobacco industry, the opioid industry, and others, we talked about Johnson & Johnson with the toxin products, that they knew that there was something, that these manufacturers knew there was something harmful that could kill or severely injure people, and they unleashed this vaccine, oh yes, you'd be able to sue because that's intentional. They knew it, they duped the public, and there was fraud. I'm not saying that's the case. I'm saying if there were ever evidence developed. So let's just keep that in the back of our mind. Put it on a shelf in your mind when you think about, can you sue those manufacturers? But for any unintentional consequences, no, you cannot. And that's why people are upset, because they said, well, anything else happens. If a doctor does something to me and it's malpractice, I can sue him or her, but I can't sue these manufacturers of this very, very significant vaccine. No, you can't right now unless somewhere in the world down the line. So you have a lot of conflict in the law. And it probably, ladies and gentlemen, is going to go up to the U.S. Supreme Court. Why is that significant? Because you got to look at the composition of the U.S. Supreme Court. Yes. So when we talk about the political issues associated with this vaccination, you've got states that are implementing the mandates unequally. There's a federal mandate that people are sort of respecting, not respecting. You've got states that are imposing their own laws, and different states are imposing different things. There's going to be litigation, and when there is inconsistent application of the same law, which could be the interpretation of the Biden action plan, it's headed up to the U.S. Supreme Court.
Well, hold that thought. Before we go, because I want Dr. Verholden to speak to this. Undomesticated African Goddess. I love your handle, girl. She said a lot of these hospitals, mine included, have really relaxed safety protocols, and yet they're firing staff members who are not vaccinated. All of these contradictions further fuel mistrust of our vital health authorities. Dr. Verholden, we are in the election season. You are an epidemiologist who is in the public health space. What do we do with that?
Dr. Verholden? I'm not sure the question.
Well, the question is, what do we need to do? What should we be calling for? Because people are calling for our votes now, right? What is it that we should be demanding as workers, as patients, as consumers in the health space? What should we be demanding?
Well, the first thing I think is that people need to, but again, when you look at the opinion ratings, these lawmakers who've done these, to me, really heinous things, governors suing mayors, a mayor should have the right, that the mayor was elected by the people of that city to lead that city. And when you got a governor suing a mayor for doing what they think is right and what is, public health informed and all of that, people need to first have a real reckoning. See, it's really just really sad and heartbreaking for me to watch people do things not even in their own self-interest, because it taps into something real deep in the seat of their soul. There's something about these leaders and how they've used this moment instead to protect people as an opportunity for political gain. But there's something that resonates with people, from these folks. For the other people who are sort of, it doesn't, then be true to that. And when you go to the ballot box, don't give your vote to somebody who let hundreds of thousands of people in your state die unnecessarily. Don't give your vote to somebody who prematurely or did not extend the stay of eviction in your state. Don't give your vote to somebody who, mandated you to get a shot in your arm, but not the person behind you in line to have a mask over their face. I think people need to just have a real reckoning with, look at the record. Because a lot, this is what happened with our, current administration. They came in and just basically saying, we will definitely be better than the last guy. But they didn't really tell us how that was going to be and what they were going to do.
And you know what?
Just being better than the last guy.
And we didn't ask.
I mean, we now see what that gets us.
Yeah, and because
we didn't ask, but we probably should have done more than that. We should have demanded.
Yeah, absolutely. And that's why I'm asking you. The demand ought to be what in 1 minute?
Yeah, so clearly I'm going to go back to my same thing. It's always for equity. People don't understand that equity, I'm not asking anyone for a handout. I'm asking for something that will level the playing field. If we want to deal with the fact and how we got to be such an inequitable society, we got to reckon with the things of the past. And people oftentimes will underestimate, but there is a legacy effect of redlining. Redlining blocked my grandparents from ever actually being able to own their home. Owning a home, if my grandparents had owned a home, it is estimated that I would have 2.5 times more the assets that I have right now, just from that one factor alone, if my grandparents had ever owned a home. Why? Because once you own your home, you've got equity, you can send your kids to college, you can do all of these things. I am still paying the price of redlining that my grandparents and their parents endured. These are the gifts, and inequity is a gift that keeps on giving. So if we want to redress that, we've got to be truthful about the impact of these policies and their legacy, long-standing effects. And we've got to have equally weighted policies that restore people to whole and that create new opportunities and openings for people moving forward. So we need things like universal health care, guaranteed quality housing. The list goes on, but these are just some of the very basic things.
Well, these are the things. I know it sounds like you're not a broken record. These are the things that we need to be talking about going into the 2022 season. Don't be frustrated, everybody. Be empowered. There are things that you need to be asking people who are running for office. There are things that you need to be demanding, requiring of the people who say they want to represent you.
5.
If they want to continue or if they want to start. There are things that you need to make sure that they understand that you need, and you need to make sure that once they get to Washington or to Springfield or to a state capitol or to City Hall, you need to make sure they come through for you. Dr. Deborah Furr-Holden and Dr. Shanita Knighton sending you much love. Doctor, it's Legal Q&A with CK on the Santita Jackson Show. And Tom Thomas is going to join us in just a few minutes.
Santita?
Yes.
I did want to just go a little further with Dr. Knighton's question. And I gave a legal framework because the question was, what is the recourse for those nurses who feel that they are operating in an unsafe workplace? Is that it, Dr. Knighton? What is their legal recourse?
Right, because the other piece, and I'm going to add on to that really quick, CK, is the fact that, like, literally, if somebody shows up and they're COVID positive, these employers are not even doing a good job to make sure that everyone is notified within a specific time. And there are no guidelines or accountability around that as well. So that kind of goes into that question, too.
Didn't you have to deal with Amazon, CK?
I did. I want to say all of these things are being litigated as we speak in our
I have Attorney Patillo.
Okay.
In March of last year, our client who was ultimately a whistleblower, he was a mid-level manager at Amazon, and he said, look, there are people who are sick all over the place. You all don't have any protocols in place. We don't have gloves. We don't have masks. We need to have something because my people are getting sick every day. And there's something wrong. We have to have a COVID policy. And Amazon basically said, yeah, woulda, coulda, shoulda, we didn't do anything. And so he said, I'm going to have to report you, which he did. He reported them to the New York State officials. And that's how he became a whistleblower. He had meetings with them because he was a mid-level manager. He had meetings with people who were getting sick, trying to get Amazon to put in place a policy that would protect those workers. Because let me just say this, Amazon did have a policy in place that they were implementing for their high-level officials. So our lawsuit was based on our client representing a class of people who are Black and brown because the people impacted by all of this non-action, no policies, making up stuff were Black and brown people. So that very issue, Dr. Knighton, that you're referring to, workplace safety, when in Amazon people were almost shoulder to shoulder working, packing, so that we during COVID can receive all of our packages and all that kind of stuff. Those workers were not being protected. And this was March of last year. That's litigation right now. It's a class action, those very issues. So in the workplace, what can nurses do? What is their recourse? Short of litigation, because they do have the recourse relative to litigation. But people don't have the time, the energy to often do litigation. And so I do understand that. But what they can do, there are OSHA regulations, which I pulled up, and the president has passed OSHA for all these environments that have 100 more employees. I mean, if this is what the president's going to mandate, what is OSHA saying and what will be the mandate? Because I haven't seen the full mandate, but OSHA is tasked with implementing a system for safety in these environments that have 100 or more employees, which will go directly, Dr. Knighton, to your point.
Well,
so
you know what?
That should be coming out soon. And then the other recourse, of course, is litigation. Them coming together, and also the other thing, too, meeting with management at the hospital and saying, look, this is a problem for us in terms of the healthcare measures that are in place at the hospital for our safety and the patient's safety in a COVID environment, because it's not working.
Now, you know what, ladies, I want us to continue this conversation because this is something that Dr. Knighton has really been very, very fired up about. But I'm going to have to let Dr. Knighton and Verholden go, unless they want to stay with us and talk to Atan. But I need these two lines. I've lost a couple of lines above. But I need these two lines because I need to populate from the bottom. I know this sounds crazy, but the fewer lines I have at the bottom, I can't get calls can't get through. So I have to let you all go. But we're going to continue. CK will be with us in the morning. Don't worry, Dr. Knighton, Dr. Verholden.
Mr. Thomas is on the line.
Okay.
Okay, well, have a great show.
Thank you so much. I'm going to let you all go. And if you could, when we let them go, Paul, if you could bring Mr. Thomas on at the bottom, please, so we can free up those call lines, please.
Okay.
Okay, thank you so much. Robert Patillo?
Good morning. How are you?
Good morning. How's everything coming with the conference?
So far, so good. So, T-minus 24 hours just about. So looking forward to it.
It's tomorrow. Okay. Okay.
He's doing a great job.
Oh,
he's doing a great job.
Says Madam Chair. I love it.
Thank you so much.
I love it. Well, Robert, if you want to stick around with us today, you're more than welcome to. We're going to be talking with Atan Thomas, who is an NBA veteran. He played with the Wizards and the Thunder, and he played with the Hawks. And we're talking about these vaccine holdouts.
Sure, I'll be glad to hop on.
But of course, we're going to let him. He has a wonderful piece that just came out, a wonderful letter that he wrote to Jonathan Isaac in the Guardian today. I read it as we were coming onto the air, and it really is. It's a wonderful, wonderful letter, and it shows that you can disagree with people without being disagreeable. And he's just a real stand-up guy, really brilliant. Basketball player, husband, father, poet, motivational speaker, best-selling author. He just does so much, and he's done so much to make us all so proud. And so Just stay right here. We're going to have Mr. Thomas on shortly. Hey, everybody. Thank you for going over to the YouTube channel. Please continue to go over to the YouTube channel Kenneth D. and Dave and El Truth, El Truth though for sure. Well, was it El Truth though for show? Oh, for sure. I love it, love it, love it. I'm going to reach out to Francis Boyle. I promise you I will do that. In fact, Professor Boyle taught my brother, former Congressman Jesse Jackson
Back in
Jr.
30.
in law school. So, and my brother, they both have a mutual admiration society. Okay. Yvette, you all need to call in sometimes because this is a lot to read, everybody.
15.
And Yvette, you have so much to
5.
say. Stay right there. Do we have a town on?
We do, yes.
Yes,
Okay.
ma'am. How are you doing?
It's great hearing your voice. Hold on, please.
This is the Santita Jackson Show.
Determined, unstoppable, achieving the impossible. We're standing tall with our heads held high. We are victorious.
Hey, everybody. Welcome to the Santita Jackson Show, Wednesday, October 13th, 2021. I'm Santita Jackson, coming to you from WCPT, the nation's largest progressive talk radio station, and AM 950 radio, the voice of progressive Minnesota. Everybody call us at 773-763-9278, 773-763-9278. If you want to text me at that number, please thank GWC Injury Lawyers for that opportunity. Want to hear what your thoughts are about the NBA and the vaccine hesitant. Why are we talking about the NBA and not the firemen and women across the country and the policemen and women across the country who are very, very reluctant? They're refusing, quite frankly, to take these shots. And that is their option. But focusing on the NBA, which has, they're more than 90% vaccinated, it's averaging to one player per team who doesn't have the vaccine. But we're going to talk about that with Tom Thomas, of course, a brilliant NBA veteran. And of course, he played with the Wizards, he played with the Thunder, he played with the Hawks. He's a best-selling author. He's a motivational speaker, husband, father. Oh, my goodness. He has done so much, and he has written a brilliant piece that's just debuted in The Guardian just a few hours ago. And we're going to hear about this letter, and then we're going to have some of our lawyers join in because it's legal Q&A with CK Day right here on the Santita Jackson Show. Let's get some of these headlines out the way so that we can talk to Tom Thomas. Everybody, in Chicago, we're going to have a high of 71 degrees, mostly cloudy, nice and warm in October in Chicago. Minneapolis, St. Paul, 63 degrees. Thunderstorms. The Dow closed down 117 points. The NASDAQ closed down 20 points. The S&P 500 closed down 10. The White Sox, they're out of the running for the American League Championship. Oh, they were routed last night by the Astros, but they gave us a thrilling year, everybody, did they not? The Astros 10, the White Sox 1. The Astros will advance to the American League Championships. They need to do us proud, everybody, as the Sox have done all year long, everybody. The NHL, it's opening the season. The Chicago Blackhawks will be playing the Avalanche tonight. Hey, this is one of those rare times when everybody is playing. Everything is just great. It's wonderful, everybody. William Shatner, that's right, Captain Kirk, 90 years of age, is going to blast off on a Bezos rocket to become the oldest person in space. That happens later on today, everybody. And sadly, in Chicago, a 14-year-old girl and a security guard were shot outside of Wendell Phillips High School in Brownsville. That is the iconic high school. So many of our greats went to that high school, praying for those persons today, everybody. So I want to yield the rest of my time on my headlines to you, Attorney Robert Patillo, civil rights lawyer who is also the Southeastern Regional Director for Rainbow Push. And there's a Creating Opportunity Conference that is coming up starting tomorrow. What did you say? Your T minus 2,400 hours.
Yes, thank you so much, Santita. I want to thank everybody who these registrations have been coming in really fast. I want to thank your listeners so much for supporting the conference. It's the 22nd annual Credit Opportunity Conference presented by the Rainbow Push Coalition's Peachtree Street Project. So the Southeast region will be highlighting everything from a Women in Leadership Roundtable and international panel. Black farmers will be discussed. We'll be talking to our corporate sponsors about their corporate responsibility. We're going to have a small business panel where we talk about entrepreneurship. And then I think my favorite panel of the entire event is going to be the youth entrepreneurs, where we're going to have entrepreneurs between the ages of 6 and 15 discussing their businesses and then working with business leaders to discuss what they need to do to grow their little child businesses into full-blown industries by the time they're adults. So people can register at the creatingopportunityconference.com. It is 100% virtual, 100% free. We do want people to get Rainbow Push Coalition membership. You can do that at rainbowpush.org. It's going to be an outstanding event, as we said, free of charge and great information. So remember, that's creatingopportunityconference.com, and it kicks off tomorrow morning at 9:30 a.m. Eastern, 8:30 a.m. Central. And it's going to be a 2-day conference that we will be replaying online also.
Absolutely, absolutely, everybody. Please go on to be a part of this conference. I've been bringing him on, and we want you to know that it will not cost you anything. We would like for you to join Rainbow Push, though. Please do that because these conferences are not. They cost us to put them on, but Reverend Jackson wants to provide this service to you. This is part of his ministry for you to have opportunities. So from 6 to the age of Methuselah, you'll be able to get something from this conference. Stay right there, Attorney Robert Patillo and Attorney C.K. Hoffler, chair of Rainbow Push, and she's also the immediate past president of the National Bar Association, the largest and oldest black bar association in the world, more than 65,000 lawyers. She's a brilliant practicing attorney herself. I'm so excited to have this gentleman with us. He's one of my favorite people in the world. Got a chance to see him during the NBA All-Star weekend. I just couldn't believe I'd never met him before, but I felt like after having talked to him just a few times that I already knew him. Atan Thomas, indeed. Atan has played with the Washington Wizards, the Oklahoma Thunder. He is from Tulsa. He played with the Atlanta Hawks. Brilliant NBA veteran, and he has been able to go from the NBA to becoming a best-selling author. We Matter. He's talking about, you got to get that book as he looks at black athletes and their activism. You've got to admire this man, husband, father, and someone who is trying to pick up all of our children as he goes along. He wrote this wonderful letter to one of the unvaccinated NBA players, to Jonathan Isaac, and he expressed his admiration for him initially, and even as he disagrees with him, with some of his reasoning, he has done this in such a way. I think this is just a wonderful lesson for all of us to learn. But we want to talk about this letter that he's written to Jonathan Isaac, why he wrote it to him, and want to look at what's happening with these unvaccinated players. The Brooklyn Nets just said yesterday that they will not let Kyrie Irving play on the road and not at home. They said either you are going to be you get vaccinated or you will stay home. You just won't be here. I don't know what that's going to mean for him contractually at time, but wow. Talk to me about this letter to this young man, Jonathan Isaac, who is very, very bright, very articulate. I've been impressed with him as I've watched him. Just like all of us, or not all of us in the world, but certainly Mr. Isaac, you and I are Christian, and to hear him give this powerful witness in these different settings, he's been so impressive. Talk to me. You said, though, that what he's doing now could be used by the right to hurt a lot of people. Talk to me.
Right. So first of all, thanks for having me come back on your show. Always a pleasure. And like you said, we had a great time was it 2 years ago at All-Star Chicago? I know COVID time kind of just blends in together. But yeah, no, I wanted to write this open letter to him because I do have a lot of admiration for him. I've watched videos of this young man preaching and, walking in his purpose and being fearless and talking about, Jesus Christ and talking about his love, for the Lord and everything and that's not something that you typically see in the NBA, especially for him to be so young. I believe he was 20 at the time when he gave his first sermon. So I was intrigued by him, and I was impressed by his delivery and his passion and his commitment to really try to be on the path of being Christ-like. And to hear him express that. So I definitely agree with him. So there were different things that happened before that I can say that I respectfully disagreed with him on. He was one of the only players that didn't take the knee during the national anthem when they all collectively did it, because he had a different interpretation of what Black Lives Matter meant. And as I'm listening to him, I'm saying to myself, I hear him kind of repeating a few of the same explanations that I hear from the right. But you know what I mean? I still respect the fact that he was able to take that stand alone. I mean, he was the only person on the team.
Yeah.
Just from that standpoint alone, I was like, oh, wow, I respect that. Even if I disagree with his interpretation of that led to why he was taking a stance, if that makes sense. So then just recently, so even back then, when that happened, a lot of places was reaching out to me in particular to come on their shows and bash him and try to silence him and discredit him. And that's the part where I pushed back on that a little bit, because, I was like, well, we can't do the same thing that the right does. That's what the right does when they disagree with somebody. They try to discredit them and silence them and stuff like that because they disagree with their message. And so I always refused to go on those shows because I saw their agenda. And so recently he's expressed his hesitation and his uncertainty around the vaccine, and as have a few other players. You mentioned Kyrie. There's been Bradley Beal here in D.C. A few other players, Andrew Wiggins with Golden State. There's a few players here and there that have expressed their hesitancy.
No, even LeBron. Although ultimately
he took the vaccine, but LeBron said that he was not going to bash the other players who didn't take the vaccine.
But he also said, it took me a while to get here. I do a lot of research.
He said that.
I was hesitant.
He said that, but then he said he eventually got there.
Yeah.
So at that time, the players that didn't get there, they wanted LeBron to bash them and say, forcibly, you need to do it and everything like that. He said, well, no, I'm not going to do that.
Well, and the NBA wanted him to promote the vaccine. He said, I'm not going to do that either.
I'm not going to do that either.
That's right.
And that's not, and it's just where, when I see the left taking on the characteristics of the right, then I'm like, well, and I kept saying, I've said it on a couple shows, I was like, well, we can't do what the right does. You know what I mean? I've seen these different articles and the way that they've been describing some of the, the players and using words like stupid and dumb and uneducated. I'm like, whoa, you don't realize that y'all sounding like Fox News? Like that, it can't be that. So I started really having an issue with that. And I wanted to, call that out more and more. So I started doing that. So then coming back to this young man, Jonathan Isaac, I saw him go on Fox News, and I saw them trying to, what I felt is hijack his vaccine uncertainty to kind of blend it in with their anti-vaccine platform. And so I wanted to write this open letter to tell him, hey, beware of them people. They're not on your side. These are the same people that have been telling all of us to shut up and dribble, to stay in our lane, to stick to sports. And now you see those same people, Ted Cruz, Donald Trump Jr., he just tweeted out his support for Kyrie Irving last night. Like all these people who are now trying to praise you, but you gotta think of why. Like, why are they doing that? Do they really respect you, or is it just until you disagree with them? And that's really why I wanted to write this letter. But it is interesting. I will say it is interesting because this is not a characteristic that is solely on the right. As I said before, I've seen a lot of the left do that right now. So that's just an unfortunate reality, is that when people disagree with you, They want to silence you. So I wanted to write this article where showing, yes, I have a different opinion than you do, but I don't have to try to discredit you or demean you or silence you. I can just say I have a different opinion than you have.
But see, I appreciate the fact that you went through. I mean, you are very, very, and not word. You are very honest in this. Number one, it's a letter, and I think it's written in a loving spirit. But you said, I disagree with you, but let me tell you why I admire. Let me tell you why I admire you. I respect you, and I've disagreed with you about not taking the knee, but you were willing to do this alone. And even as he expressed his reason for not taking the knee, and I disagreed with that at times, but he did it in a loving way. He didn't condemn it. He didn't condemn anybody, and I appreciated that. And I said, okay, well, I think he's trying to take this Christianity thing a little seriously, and and I appreciated that. Even as I love your book, We Matter. That's why I said I don't know. He needs to read your book, but I'm going to leave that alone. That having been said, where are we? Because now you do. Is he still holding out on the vaccine, Jonathan Isaac?
Yeah, he is. He not so much holding out. I would say more though that he's still gathering different information for what he said in his press conference. And he said that he's just not comfortable taking it.
Okay.
He's looking at different things. This is the last press conference that I've seen. This was maybe about a week and a half ago. So I don't know if he's progressed since then. But he said, he was looking at the fact that he had COVID before, and he was, he's trying to see if the antibodies would be enough or a better option than the vaccine, and then he has concerns about the long-term effects of the vaccine. All valid questions. It's not like he's saying anything that's not valid. You know what I mean? It's just the fact that with the NBA, I understand from their standpoint that how can they even put on the NBA if they do not go this route in terms of taking whatever measures they have to keep people safe. So I understand from the NBA standpoint, but I also understand from the player standpoint of why they would be hesitant. Just like a large percentage of the population in the country are hesitant right now. You know what I mean? I just didn't like the demonization of particularly black NBA players to resulting to calling them uneducated, dumb, stupid, stuff like that, because they have that hesitation that I think is very well, understandable why they would have the hesitation. So that's the problem that I have right now.
Well, you also, it's everyone, it's a brilliant, brilliant, brilliant letter. You also said, wait a minute, we're calling out the NBA players, but we're not calling out police officers all across the country or firemen and women all across the country who are absolutely pushing back. Why don't you explain?
So, all across the country, police departments they have a really low vaccine rate. I examined two particular police departments, the NYPD and the LAPD. And the NYPD in particular, they came out and said that, they do not want to take it. They didn't say they were doing more research. They didn't say they were trying to figure out different options. They said, we refuse to take it. And they said that we refuse to wear a mask when we're encountering people. And then they said, the police chief said, well, I'm not going to, have a mandate, even though New York has a mandate. It's the same thing in L.A. The sheriff, Villanueva, I think that's his last name. He said the same thing. I'm not going to make a mandate for my officers because they said that they'll quit if I try to make a mandate. Now, he's expressing this. So I'm just like, okay, we have bigger issues as a society than if Kyrie Irving wants to take the vaccine or not right now. Like if you're gonna bash NBA players to this level that you are and call them every name under the sun, I want to hear that same thing for these police departments. You know what I mean? And I haven't heard as much. I honestly haven't. And the thing is, they are outright saying that they refuse to take it. That's not what these NBA players are saying. They're not saying that they're anti-vax. They're not saying that they're saying at this time they are uncomfortable. And I don't know if they've all talked to each other, but they all kind of said the same type of language. So they said they're trying to do more research. They're uncomfortable at this time. They're not but then I see articles that label them as anti-vax.
Which is not true. It's
That's
just not true.
They never said that. And so
But we do
I'm
that
like,
with everybody, Atan. If you haven't taken, if you are asking questions, You are anti. We have demonized people on the right and the left, which is a point that you have been making. And I think that is very dangerous. It's very, and these guys, no, you, not these, you and your wife, high level, you all are elite athletes. You know your bodies better than most, I mean, than 99% of the world do. You do. I mean, Serena Williams was in the hospital. She had a history of blood clots that almost killed her. She and her sister have profound health issues. It's amazing that they are the best tennis players in the world. Venus with autoimmune issues and Serena with the same. She has a blood clot after she has a baby. She feels the blood clot, I guess, at the bottom of her toes. She talks to the nurse. She's like, the blood clot's coming. They're like, yeah.
Right.
It's coursing up her leg, up her body. She said, no, I got the blood clot coming. She said, look, I'm not going to say what I think she said on there. Look, I got this blood. It's almost here. Would you get this, please? This woman almost died after childbirth. I mean, and so these people know, you know your body. And since your body is how you make your living in part, to ask questions and to say, wait a minute, I need to wait and see, the demonization and calling out the NBA and not calling out, I'm going to say it, the white police unions. It's just kind of interesting to me, Atan.
Yeah, I agree. I agree 100%, and that's why I wanted to really point that out. And also I wanted to put in perspective the numbers and the percentages that we're talking about, because sometimes it gets lost in some of the commentary. We're talking about the NBA right now is 95% vaccinated. 95%. So we're literally talking about one player maybe on each team that hasn't been vaccinated. So you compare that to the level of the percentages of the NYPD and the LAPD
and the Chicago
Police
Police
as a
Department.
whole. I mean, your expectation is to have 100%, or else they're all idiots. You know what I mean? I mean, and that's the part where then you have to understand. And a lot of these places that are making these articles right now and saying these commentaries and things that nature, these are from the left, right? And these are the same people who were praising athletes for standing up after George Floyd, after Breonna Taylor, after Jacob Blake, and they're praising athletes for using their platform and standing up for their belief in and everything like that. But then as soon as it becomes an issue that they disagree with, they have a different opinion, and now I'm talking about the left. Now these same liberal sites, these same commentators that once professed their love and admiration for athletes just like a year ago, they're now calling athletes stupid and misrepresenting them on purpose, because they know they didn't say they were anti-vax. But now they're going to present them as anti-vax in order to criticize them. And I'm like, well, wait a minute. Y'all acting like Fox News. This is what the right did with Colin Kaepernick. They knew what he stood for, and they purposely misrepresented him in order to demean him. That's what y'all are doing. And it's wrong either way. And I really wanted to make that connection, because it's not something that just the right does. You know what I mean? The left does that as well, and it's wrong either way.
Well, Atan Thomas, everybody. Can you stay with me for a little while, Atan?
Sure.
Because we have some of these lawyers who want to talk to you about this. I mean, look, everybody, Fox News and the right will praise unvaccinated NBA players, then use them. So
15.
wonderful, wonderful letter. But, the headline is kind of misleading because it's a little deeper than that.
10.
He is letting you know that, wait a minute, we're attacking people without talking to people. And we're going to talk about Kyrie Irving when we get on the other side. Did you know that he is a member of the Standing Sioux Nation? Because his mother was. He's got a very interesting background. These are some really thoughtful guys. Let's talk about this with Atan Thomas. You know something about that NBA. I like you guys. Back with more of the Santita Jackson Show in just a few minutes. Atan, you are on fire. I just love you to pieces. I just wish you wouldn't boycott me so much, but that's all right.
Thank you. No, sure, it's good.
Wow, I'm turning into my dad. That's scary. I'm feeling abandoned.
How's he doing? I saw he just had a birthday to pass.
Oh, honey, he is having parties like you would not believe. It's bless his heart. He's having to pace himself a little bit differently, and that drives him crazy. But he's
I'm
doing.
sure.
No, honey. He left the hospital and went to the office, literally.
Yeah, is that right?
Yes. Yes. And there was a couple of meetings set up, literally.
Mhm.
I was like, because I came by the office because I was dropping something off, and I saw his chief of staff outside. I said, "Don't tell me Dad's here." He said, "Yep." So he just got out of the hospital like an hour ago. What? Yeah, he was right there, and some people were coming over. And God bless him. I want you to meet C.K. Hoffler. You might have met her that All-Star weekend. We were all here. She is the past immediate president of the National Bar Association, which is the largest and oldest black bar association in the world, 65,000 lawyers. And she's also the chair of Rainbow Push. Robert Patillo is the Southeastern Regional Director for Rainbow Push, brilliant civil rights lawyer, and they both have their own shows on WAOK, which is the iconic black talk radio station down in Atlanta. CK is on Tuesdays at 11 a.m. Eastern Standard Time, and Robert is 1 to 4 every Sunday Eastern Standard Time. But this is her show now. Right now, she does legal Q&A with CK on the Santita Jackson Show. But we said we'd bring you in on this today because I had to get you. Had to get you when I could. Had to get you when I could, and then when I read this. So say hello to Atan Thomas.
Well, good morning. I have to tell you, I really, really enjoyed your comments. What you did is you pointed out the hypocrisy of this whole discussion, because it really is hypocritical. It is hypocritical. Anytime it's just hypocritical. The whole discussion, the whole mandate on some levels is steeped in hypocrisy.
Mm-hmm.
However, I'm a mother of two athletes, athletes, 11th grader and a college, both play football. And this whole question, it is a personal question for me because of the decision that we made as a family to have our children vaccinated. And I know at the time that we did, people were, and it's not that we are pro or anti, that's not what it is. It's the decision that we made for our children at this time, because that's what and as a lawyer, as a practicing lawyer, someone who advises clients on what their COVID policy should be, the legal consequences and all of that, I make it very, very clear that when you mandate anything, you're going to get pushback. If you talk to people a little bit, if you talk to them about issues, you will get less pushback. But when you mandate, for sure you're going to get pushback, because people, even young folk, as my son told me in college, just feel some kind of way. You know, they turn 18, they tell you they're grown. They feel some kind of way about being told to do something. And that, in part, is what it is. And these are legitimate concerns. So I do get it. But on the other hand, I do understand
back in 30
why in a profession where you're sweating, breathing, contact and all that kind of stuff, where you are more, there's no social distancing when you're playing football or basketball. It's the exact opposite. You're in that, it's a contact sport, personification, and there is a stronger likelihood if you do
Stand
have
by.
the virus that you're going to spread it.
Hold on,
So
stand
I
by.
understand both sides of it.
Stand by, stand by, stand by. All right, Robert, you still there?
I'm still here.
Okay, well, this will be fun.
This is the Santita Jackson Show.
Determined, unstoppable, achieving the impossible. We're standing tall with our heads held high. We are victorious.
Hey, everybody, welcome back to the Santita Jackson Show, WCPT 820, the nation's largest progressive talk radio station, AM 950 radio. The voice of progressive Minnesota, 773-763 WCPT, 773-763-9278. We're talking about the vaccine mandates and the NBA. I think that's just the way we have to put it broadly. We're speaking with the brilliant Atan Thomas, NBA veteran, best-selling author. You've got to get his book, We Matter, Athletes and Activism. It seems like from the right and the left, we have been telling these brilliant athletes to shut up and dribble. Atan, I don't know any other way to put it. You know, we heard Laura Ingraham, and then we were like, oh no, she's saying that. But we're kind of telling them to do that too. And, you know, as I was reading about Kyrie Irving, As I've been watching these young men make their cases, and I've been very impressed with them. And I didn't even know Kyrie Irving's background. I didn't know that he was part of the standing Sioux Nation. I didn't know that his mother was half Sioux. I didn't know that he has dual citizenship with between Australia and the United States. That he grew up in Montclair, which is an upper middle class area. That his father was a professional basketball player. He's got it, and so he's got an international perspective. This is not these people like you are not folks who are. I mean, as people are hearing you, they're like, wow, these people are putting a lot of thought into what they're doing. Where's all of this going to go? Because the Brooklyn Nets have said, you can't play unless you're vaccinated. What do you think is going to happen now?
It's interesting. I'm not sure. I didn't think that it made much logical sense for him to be able to practice but not play. Like they was having that discussion. So I kind of thought that this was going to be what happened. And that's what every indication before the season was, that players would have to eventually, I guess they were tiptoeing to it. You know what I mean? They didn't want to just outright, but every inclination, told me that this was what was going to happen on every team. And I think the one thing about, Jonathan Isaac, I was listening to his press conference, and he said, well, of course, if I have no choice and I have to, if I want to play basketball and I have to end up doing it, then I kind of have no choice. You saw from Golden State, Andrew Wiggins. He said the same thing. He got the vaccine. He's like, well, I didn't really want to, but I was going to either play basketball or not play basketball, so I chose to play basketball. So that's kind of what it boils down to, but that's what it's boiling down to across the country. In places, a lot of places, of course, here on the East Coast, but, New York, you can't do anything without showing your vaccination card. Mm-hmm. You can't go into a theater, you can't go to the Broadway show, you can't go to most restaurants, and it's either, I'm not going to force you to do it, but if you want to participate in this, you have to do this. And that's just the way that the rules are. Now, once you're talking about, somebody's thoughts, feelings, and that's the part that bothers me so much, is because, people demeaning them because they didn't reach the same conclusion that they reached. Like, we're looking at the same data. We're all listening to Fauci. We're listening to the reports. We're listening to the CDC. We're all looking at the same thing. It doesn't mean that just because somebody has a hesitation that you have all this wealth of knowledge that they don't have. And that whole thing was bothering me. So, no, Kyrie Irving, Andrew Wiggins, I don't question their intellect because they came to a different, conclusion, or are just still in their process. And I don't think anything is wrong with that. But I think in the NBA, as in most organizations, it's going to be, from an organizational standpoint, kind of cut and dry. Either you take it or you don't take it. I just think that's the way it's going, and it's going to continue going.
It's going to be interesting because we're certainly watching a lot. We're watching the American labor force bleed, and it's not just because people. I don't think it's just because people want something new. I think the vaccine mandates are having maybe some unintended effect here. You stay right there, Atan, because I'd like to bring in C.K. Hoffler, attorney C.K. Hoffler, and attorney Robert Patillo. I'd like for them to weigh in on, because they've been listening to you. And I just think you're so fascinating. I'd like for you to respond to what you have heard, Attorney Hoffler, and then you, Attorney Patillo.
Absolutely. Good morning again. Well, I think what is most tragic in this whole discussion is, and what we perhaps are forgetting, is if people had racial animus before the whole COVID discussion, the COVID discussion has not taken away their racial animus. They're going to have racial animus. So the fact that they are demonizing these Black players for taking this position is more steeped in racial animus than anything else. Calling them stupid, that's a racial animus that existed before, simply because they're taking a different position. And they are daring to question because they have been trained. They've been trained to ask questions. There's nothing wrong with that. So I am vehemently opposed to this demonizing of anybody who's questioning and challenging, because quite frankly, as I discussed earlier, even the legal framework for COVID is confusing and inconsistent. And there's going to be a lot of litigation in years to come. So that's my first point. Secondly, as a parent of, athletes, young athletes, baby athletes, I would call them, I do understand the both sides of the issue, meaning the players, because these are contact sports, whether it's basketball or football, contact sports, people living, breathing, all up in each other's faces, touching each other. And so if somebody does have the virus in a contact sport, and when you're unmasked, because even if you have the vaccination, as we heard Dr. Deborah Holden tell us, even if you're vaccinated, if you come in contact with somebody who has the virus, you can get the virus, even if you're vaccinated. So I do understand that side of it, the need to protect all of the players. But I will say this, and this is what I advise my clients, anytime you mandate something, say you must do this, you're going to get pushback. People may go along with it, but then you're going to have other issues that surface. And so I think they have to be very, very, very careful with that. And people do have that this has to do with their body. But on the other, by that same token, you have elected to play a sport that's a contact sport. There are certain contractual duties and obligations. They can't from a contractual standpoint mandate it yet, but they can from a policy standpoint and from a federal law standpoint, because President Biden has put in place the law on this. He really has, for organizations or for businesses that have 100 or more employees. So there's going to be a legal justification for that. But the moral justification, and by the way, this has become very political, which it shouldn't be, the moral and the medical issues associated with the mandates, I think, have to be looked at more carefully. And we should not bash, demean, and demonize young men or women who take a position that they're not anti-vaxxers, they just want to see more research. Because, by the way, there are a lot of questions. So that's what I feel from a legal standpoint, but also from a moral standpoint. And as a mother of young men, and I talk about these issues every day, because we have to teach our children to question. We were taught to question, and we became better mothers, better professionals, better people, better citizens, more social justice oriented, because we were taught to question. So we don't need to flip the switch right now, change the script when we have our young people who are doing what we want them to do. But they also have to look at the realities of the profession and the job that they've chosen to do. And just like those young men said, I'm going to take the vaccination. I don't feel good about it, but if I want to play basketball, this is what I have to do. And that's the bottom line. And that could have more to do with contractual issues potentially down the line than anything else. From my impression.
Well, Latan, I heard you give her an amen. What was going through your mind?
Well, no, I mean, I was just agreeing with everything that she said. I mean, it is something from it being something that the demonization of these black men, which is something that really has been bothering me. It really has, but also when you're talking about your children and playing a sport. My son is in high school and daughter is, middle school, and they both are athletes, and, they have to make a decision, and I understand that from the school perspective, from the club team perspective of how are you going to operate if you don't do this. I understand it, you know what I mean? So, no, yes, and the questions that they are asking are valid questions. And that's the part where the purposely misrepresenting someone's point. And, in looking at Jonathan Isaac, I might disagree with him, but I can't just purposely misrepresent him and attribute something that he did. There was a thing that and this is the way that they, and this is coming from the left, that they tried to discredit and demean him and silence him and say that, he learned about vaccines from listening to
Donald Trump
speeches.
Yes.
And it was like, where did you get that from? And this is an article in the Rolling Stone. So I listened to his interview, his press conference, and he said, no, that's not where I learned about the vaccine. I don't even know where that came from. But just to the only reason why that reporter wrote that from the Rolling Stone purpose was to discredit him. Mm-hmm. Because once you discredit him, he doesn't know what he's doing. So you could just not even worry about what he's what he's talking about and just tell him to shut up and dribble. And that's the same thing that Fox News was doing.
But you can see it's not a Fox thing.
But can I just say?
Okay.
And by the way,
You can go on.
What if he did learn it from the Trump people? So what? He has a right to question and challenge and not be demonized. For that, the demonization is because of racial animus, because there is no demonization of the police, of the firefighters, of all these people who take the exact same position. Medical, doctors. How about the doctors who are saying, there are a whole bunch of them. I know a bunch of doctors who have said, excuse me, I am not taking the vaccination. I'm doing therapeutics. I'm doing all of this stuff. And these are probably doctors who are solo practitioners who have their own business. They're not working at a hospital facility that mandates this and that and this and that. And they can take that position and be in practice. And they're doing all the things to keep themselves, their staff, and their patients safe. There are many doctors that take that position. It's a well-kept secret. So none of them are being demonized. So the demonization, to me, is due to racial animus, just like any other type of demonization. You know, Kaepernick wasn't, demonized, excluded, and all that kind of stuff because he was a great football player when he took the knee. It was because he was a black football player. I mean, I don't think that we need to separate this discussion from the racial dynamics that we know, not that we guess, but that we know exist in this country and in the world, because that permeates the discussion. So that the right wing are emphasizing and sympathizing and high-fiving and all kind of situations, black players who are taking this position. That's political. But that in and of itself is also, in my humble impression, racial animus, where you just use, black players one side or the other just to further your political agenda. But fundamentally, these players, like everybody else who's examining this question, should be allowed to express themselves. Their ultimate decision to take the vaccine or not is probably going to be a business decision for them, sourced in contractual issues. That's the bottom line. Either you want to play and uphold the terms of your contract or you don't. When you entered into this profession, you knew the rules of the road, you knew the rules of the game. And if you didn't, you need to have somebody to advise you on that. So when you're operating in this COVID world, you may not like it. You may have to hold your nose and do it and look at the consequences and do that cost-benefit analysis. Because at the end of the day, it's going to boil down to, do you want to continue and make a living in this industry? Because this is what you have to do at this moment in time.
Sure.
And it may not be a great choice, but that's the choice.
But most of them signed these contracts before COVID. So they didn't know they'd be mandated to take a shot that they would question. So, I mean, there's Robert Patillo. Why don't you jump in here before I go to the callers? Robert, you still there? He might be on mute, but let me go on to Norma from Indiana. Norma, what's on your mind?
Thank you very much for taking my call.
Of course.
And what I really want to now, the reason I called in is because to say, first of all, maybe let's stop with the mandating, and how about just some strong suggestions? The reason I'm bringing that up is because we're not emphasizing personal immunity, and I would like all the health professionals to review my statements because I'm not a health professional. People were able to determine that Black people were going to succumb to the coronavirus a little bit more than white folks because many Black people live in food deserts. And start talking about this, how these food deserts affect our personal immunity. The other thing I'd like to bring up is concerning the players, the NBA players. Now, even if they're vaccinated, as I think it was Dr. Spur Holden was bringing up, you still need to wear a mask. If these players are not wearing masks, they could still be infecting each other because the coronavirus is airborne, and most of the people around the world are not vaccinated, and therefore many more mutations are coming along and are airborne here to the United States. These, I think that we are not really dealing with the full truth concerning this. And to undergird all of this, because you, I think yourself, Santita, had brought up I guess I mean Miss Jackson.
Miss Santita, please.
But,
come on, Norma.
Santita, okay. You brought up the concept that now this new pill has a 4,000% markup on it.
Yeah.
Well,
from Merck. Yeah.
So undergirding all of this,
and we paid for the development of it. And now the government's just purchased 1.7 million doses at a 4,000% markup. I'm like, how are you going to hand all that money over to Merck?
So,
for real?
So how are they spending our money? So I'm suggesting this real quick. Let's get that ERA, the Equal Rights Amendment, over the goal line and get more money into the hands of women to undergird the whole thing. Okay, including our election coming up in 2022. So I will take any further comments off the air if that's okay.
Oh, yes, ma'am. Yes, ma'am. Well, before we get your comment, I want Robert, you're off mute. Go on, Robert.
I'm off mute. Everything.
Stay right there, Mr.
Everything that I was saying was absolutely.
Okay, Robert.
But I do think this is almost that $20 million slave concept, where these athletes, we talk about the amount of money they make in their contracts, but at the end of the day, they do not have the freedoms that many of us would expect in our workplace. Their workplaces, their lives are their workplaces. And in large part, they're used as political pawns when they are convenient, when they are within the whatever size talking points. Well, that's when they want to promote them. We see the same thing with musicians. All of a sudden Fox News became a huge fan of Nicki Minaj 2 weeks ago out of the blue because they thought it supported their positioning. And this is why I think it's important for us to have our own independent media outlets where we can discuss issues and then talk about and represent ourselves in our own way. That's why I've loved the player empowerment movement through media, where instead of going through reporters and back channels, players are starting podcasts and is talking directly to the public instead of through intermediaries. Many of these NBA teams are kind of hamstrung by local ordinances. It's not as if Brooklyn just doesn't want Kyrie to play. New York City will not allow him to play or to come to gatherings, and the other option will just allow him to play road games, which I think will be untenable to any team. So there's a lot of competing interests. I think we go back to support our brothers and sisters in professional sports because it does reflect upon all of us. They are the canary in the coal mine to show that today is the NBA and tomorrow it might be your accounting firm or it might be your school district doing the exact same thing. So it is important to watch them and to explore the legal rights and remedies that people have if they are indeed recalcitrant or if they have religious or medical exemptions. We do have to create a framework of law which protect those individuals from simply having to bend the knee to these arbitrary mandates when there may be other options.
Tom Thomas, I'm getting the sense that you see, I guess you see unfairness coming from the right and the left. You're seeing demonization of these athletes coming from the right and the left. You're seeing the right and the left go past the police, go past the fire department, go past all of the big white professions and go and zero in on the NBA. Am I correct?
Oh, definitely. I mean, and it's the left doesn't like when you point out that they do things similar to the right, and vice versa. They don't like that at all. But in this case, that is what happens. They're all for you until you say something they disagree with, and then they demonize you the same way. I mean, it's amazing because one of the things that you saw, and I've experienced this so many different times, because a lot of the positions that I have taken, as far as anti-police brutality, against like the war in Iraq when I was protesting that, against the death penalty. These are things that the left have gravitated towards me on and been like, oh, yes, we support you, everything like that. But then if there's another topic and I'm like, well, no, I don't quite agree with you on the transgender topic of transgender athletes competing against, like I said, my daughter's a volleyball player, so a transgender, coming in and then dominating. I don't agree on that topic. Now it's like, oh, well, how dare you? And I was like, well, wait a minute. I have to agree with you on every topic for you to be able to, you know what I mean, support me.
Yes.
Like I had so many stories like that. I mean, I was on South by Southwest, and we was discussing this topic one time, and it was right after the UFC fighter. I don't know if y'all remember this. It was a few years ago. The UFC fighter was transgender, fought against another woman, and literally broke her face. Her whole face was broken, right? So I was like, well, I can't support this. He should have been fighting, you know, the transgender athlete should have been fighting against the woman. It's that you can't do that. And they got so upset with me. You know what I mean? I was like, but we disagree on this one topic. Why can't we still look at the topics that we agree on, and then the topics that we disagree on still respect that I have a different opinion as yours? And I always point this out, that the left does the same thing that the right does. You know what I mean? All it takes is the right topic for you to just. So it's almost like, you know, I supported you when y'all were getting killed by the police, so you have to support me in everything that I believe. And I'm like, no, that's not how this works. That's not how it works at all. You know what I mean? I can agree with you in this topic, and I can disagree with you on that topic. No. And that's a bigger issue that I want to be able to have a conversation about, because it's one that the left doesn't want to talk about at all. Now you saw the whole thing in the uproar that happened with Dave Chappelle. You know what I mean? It's like, you know, he was proving a point, and they proved it for him. You know, even with this kind of the situation with Coach John Gruder, when the first emails came out, and they were the racist emails, where he said he was talking about
his lip size.
NFLPA president, right? They was talking about his lips. He said, "Oh, he got these big, you know, Michelin lips. He's dumb. Yeah. He's all this stuff." And people were saying, "Well, it happened 10 years ago. You know, he said he's sorry, everything like that." Then the next day, more emails came out, and they had some homophobic things on it. And I swear, it was like an hour or two later, he was resigning. And it was like, and all these people was like, "Oh yeah, he can't work anymore." I was like, y'all are proving Dave Chappelle's point. You know what I mean? So it's a deeper conversation that the left doesn't want to have, but it's an important conversation to have.
You want to come back and have that conversation?
Sure.
No, because really, I think that we need to have it, because I think what undergirds all of it, we have to look at white privilege. We have to look at really whether we're white, black, brown, yellow, or red. We don't know how to agree. We don't know how to disagree without being disagreeable. CK and Robert. And Etan, we don't know how to do that. We don't have mature conversations. And I really have tried to be guided in a way that this platform would be a comfortable place to have uncomfortable conversations. You know, and that's really, CK, that's what we try to do here. We try to have a comfortable space where people have uncomfortable conversations, Robert. I mean, and that's, at the end of the day, that's what we're trying to do here. Everybody, I posted, because I just got it, this wonderful letter by Etan Thomas, and I want you to get his book, We Matter, Athletes and Activism. It is so, he interviewed all of these great athletes, so, and they took you through their histories of activism and brought us into the current day. You need to get this book. You need to pay attention to this brother. He is absolutely brilliant, former basketball player, Washington Wizards, Oklahoma Thunder, Atlanta Hawks, best-selling author, husband, father. I mean, he ticks all the boxes. And as you can see, he is not scared, as they say. He was going to say what he needs to say, because I know at South by Southwest, CK, he was about to get beaten up. I mean,
Did you say he's not scared?
He's not scared.
He's not scared.
He's not scared. I mean, because he did what Jonathan Isaac did. I said, "You said that at South by Southwest? Okay. Maybe he shouldn't come back here, CK. I don't know. I'm just playing."
No, we love this is magnificent discussion, because we need to have these discussions. And
Absolutely.
We thank you for always providing that safe place, Santita, for people to speak truth to power and speak their truth.
Well, we're going to have him come back to talk about what happened to South by Southwest, because I think that's a conversation that we need to have too. I love you, everybody. Stay right here. We're going to get some closing thoughts on the Santita Jackson Show YouTube channel and on the Santita Jackson and Friends page. I love you. See you tomorrow. Is there anything that has not been said, Etan Thomas? Is there anything else that you'd like to say? That has, because I mean, you went all the way over here.
I did.
I love it. No, wait a
Okay.
hold
Yeah.
because Chris Broussard was on Reverend Show, and boy, one of the guests whose name I will not mention went ham on Chris, because Chris made the same point. He said, "Whoa," but he was talking about the bathroom, issues, and the trans community and blah blah blah. I said, and this guy jumped all over Chris, and it got really contentious. And my father was sitting in the studio. CK, Robert, Reverend well, he just went blank.
Right.
My father's a Libra, truly. So all conflict and all that other stuff, he just kind of tunes out. Believe it or not, I mean, he'll talk truth to power, but when it gets loud and all this other stuff on a personal level, he tunes out, because that's just he doesn't do that well. But I mean, but Chris was not being aggressive and mean. He was speaking as a husband, as a father. He said, "Wait. I'm feeling some kind of way about someone who is in transition using the bathroom as my daughter, and he has the right to do that. It doesn't mean that you are transphobic. It doesn't mean that you are homophobic." And you made your point on your Twitter feed. They have made David Chappelle's point, and they have, because you can insult black folks. They talk about this man's lips, CK. This guy was so insulting. But we're supposed to get over it. It happened in 2011. Have at it, Atan.
Yeah, no, that's what it is, and the response has always been, it's completely different. It's like night and day. And if anybody has seen the Dave Chappelle special, that was one of his points. He was talking about the baby. He said he actually killed somebody, and it didn't affect his rap career at all. You know what I mean?
Yes.
It was like, but just seeing, and it's so crazy that right after the special came out and all the controversy happened, everybody in the uproar, then this John Gruden situation happened that literally proved everything that Dave Chappelle was saying. Because the first time, initially, when the emails came out and he was saying the racist stuff about DeMarcus Smith. Now, if people don't know who DeMarcus Smith is, he's the union president of the NFLPA.
Mm-hmm.
He is very intelligent. You can call him a lot of things, but unintelligent is not one of them. But he opened it with, that he is dumb. Used those words again, insulting his intelligence, and said he's sitting there, with his big lips looking like Michelin tires.
Michelin tire lips. That's what he called them.
Yeah. That's what he said, and so but then you saw his apology afterwards, and that was real interesting, because afterwards he came on. He said, "Well, listen, he said, I don't have a racist bone in my body. I'm sorry if I offended," and that whole thing. And then he went on and was like, I don't want to, we don't have to talk about this anymore. Let's go concentrate on football. Everybody was like, well, hold up, you kind of jumping past it kind of quick. You didn't even get the whole apology out yet. But then a lot of people, in mainstream America, a lot of commentators, everything like that, they were saying, well, it happened 10 years ago. He said he was sorry. The Raiders have bigger issues to focus on right now. And I was amazed listening to these commentators say these things, right? And this is both black and white, because Stephen A. Smith said the same thing. He said, well, I don't think he should be fired. That might be a little bit too much.
Bring Kwame Brown on, please. Stop it.
Right,
don't get me started on that, okay?
Yeah, I know.
Oh.
But then, literally the next day, like 24 hours later, some more emails came out, and he said some homophobic stuff, and the whole tone changed. Everybody was like, oh, no, he got to go. Like, he can't, no, that's unacceptable. Like, I was like, wait, did y'all see that y'all taking Dave Chappelle's point? The racism was okay. And we're supposed to just be okay with the racism, give another chance, 10, all the different excuses. Can't we all just get along? 10 years ago, all this stuff. When the homophobic came, you don't even need to know the context of it. You don't even know, you need to know anything else, but he said something homophobic, boom, he should be gone. And that's the devaluing of why is one, worthy of an alarm, and the other one, we're supposed to just, you know what I mean? Just put that to the side and forgive and forget and just move on.
Well, and not just forget. They don't even care if we forgive, because that's the presumption that we forgive. And and I'm tired of that. But that we're the ones who have to stand up on that and say that's unacceptable. It's just unacceptable. We're the ones who have to say that. Every other community lets you know what's unacceptable. That's unacceptable. Michelin tire lips, that's what the man said in the memo.
That's what he said.
That's what he said.
Yeah. So, Santita,
Yes.
I have to run, but
Okay.
I just wanted to say all of this, again, before the COVID debate, if there was racial animus, there's going to be racial animus after the COVID debate and during. And that informs why this type of thing is happening. Nobody said anything about any of the white players who this and that and all of this and that to the this and that to the this. So I think that we just have to call it what it is. We know what it is. We see what it is. But we, and I think the players who have immense power, in my impression, because I think that sports are a religion. So anytime you have the convergence of, you know, huge liberals and huge conservatives coming together, it's because sports, these athletic sports are religion to many people. And once, to most people, to most Americans. And so once you start to flex and express yourself within the religion, which we have the power to do if you're athletes, you have the power to do that, it makes a difference. It makes a difference. We know that from George Floyd. We know that, and as well from COVID. So I just believe that dialogue is good. We should encourage that, not discourage that. And each of us should not allow the demonization of Black athletes on this COVID issue. I mean, I think we have to be intellectually honest. Either you're going to demonize everybody or don't demonize anyone. I prefer not to demonize anyone because why are we demonizing over something like this? So anyway, my parting thoughts are the legal structures that exist centered around the COVID debate and mandates are conflicting, from the federal mandate to some of the state mandate to some of the local mandates to the CDC guidelines and to the what the health authorities are saying in municipalities and cities and the like. They're conflicting, and that's why we can expect litigation, which I believe will ultimately go to the U.S. Supreme Court. That's what we need to be concerned about. If you want to be concerned about something with this COVID discussion and mandates, be concerned when it goes to this U.S. Supreme Court. And then think about whether the Supreme Court needs to be expanded. Because I got news for people who are actually not news. If it gets to this U.S. Supreme Court, we're going to see a whole different level of discussion, which many of us may not like. But that's the reality of the legal ramifications of these COVID mandates.
Well, Robert, are you still there?
I am, and I think an important thing, kind of piggybacking off what Mr. Thomas said, was the fact that if you look at the John Gruden situation, for example, and this kind of dovetails with the conversation we're having about athletes. About 15 years ago, he sent Keyshawn Johnson home for conduct detrimental to the team when he was in Tampa Bay, and people demonized Keyshawn Johnson for years that he was a problem player. It wasn't until he entered his media career years later that people got to see his actual personality. Then again, John Gruden was the coach in Oakland when they sent Antonio Brown home. And Antonio Brown, he's a bad guy. He's a terrible person. He's a disruption, all these things. And it's clear that these people like Gruden are able to shape the public perception of these athletes the same way they're shaping the public perception of people like Kyrie and Bradley Beal and Jonathan Isaacs, because they control the media narrative around it. They can determine who's a nice guy, who's Tom Brady, being intense on the sidelines, and who's a problem player throwing a tantrum on the sidelines because he doesn't know how to control his emotions. And this affects these players and their and the way they are perceived for years thereafter. If you look at someone like Randy Moss or Terrell Owens, their entire public persona is shaped in many ways by the way that these coaches and media personalities describe them during their playing career, and that reputation maintains with them for years after they are done. And so we need to watch the way that they try to shape the public perception and image of these players who are vaccine hesitant, because they will try to demonize them for their own purposes.
Because they have been called the N-word in many, many ways a time. You know, the best player doesn't necessarily get on the field or the court We see how political all of this is. That's why I've appreciated the conversations with Kwame Brown and the ones that you've had with Kwame Brown and just the conversations that you've had. Because he has treated his players like the ends. And you know what? If they didn't take it, they weren't going to stay on the team. And the owners sanctioned all of that. And we know this.
That's right.
We know it. So, you're fine. You have the final word here. And I'll come back when you are available, because we need to have a couple of conversations of politics, of sports. If you want to talk about what happened at South by Southwest, the issue with trans, because I think that's a real issue in sport. I really, really do. And I think that we need to have a thoughtful discussion about that. Tom?
Well, I mean, I just appreciate your platform and being able to, have this. I mean, I've been on a couple times now, and I appreciate the discussion. They're great discussions to have. And the presentation is always just such on a high level. So I just want to thank you for that. But yes, the main thing is that for people to be able to disagree without being disagreeable. Saying what President Obama used to say all the time. I mean, it's and this is something that the left and the right that they both have problems with, and everybody has problems with. I'm just dealing with the left and the right now. But, this is something as an entire society we have difficulty in doing. And the reason why I wanted to write this open letter to Jonathan Isaac is that I, fundamentally disagree with a lot of what he says. But I can still do it respectfully. I don't have to demean him and belittle him and discredit him and silence him because I disagree with him. And, it would be hypocritical for me to write a book, We Matter, Athletes and Activism, and to spend all this time encouraging athletes to use their positions and their platforms and to stand up for what they believe in, and then encouraging mainstream America to look at athletes as more than just athletes and, respect their minds and their opinions and their, positions, even if they disagree with you. And then as soon as an athlete stands up and says something I disagree with, for me to go and then attack him, that would be hypocritical for me to do. And it's just amazing to me how I've seen this happen in real time right now with these athletes that have expressed hesitancy, over the vaccine. And I don't think that's right. It's not right. And you should be able, and it's when you look at different shows, look on, and it's crazy when Fox News starts to resemble MSNBC. Depending
it's
on
all
the
the same
topic.
thing.
Like you're looking at the top, and they're literally tearing athletes down on MSNBC, and calling them names and all this different stuff. Like, wow.
But they've done that with everybody.
I sound like Tucker Carlson right now.
But they've done it with everybody.
That's not something that should happen.
but they've done it with everybody. And that's why,
No, they have.
and that's why I'm like, you know what, the name calling, you all stop it. Because you all, I saw it happen. If you had a policy disagreement with President Obama, oh, you're a hater. I'm like, what? This is not grammar school. This is not even high school stuff. What are you talking about? We're talking about real life stuff. This is politics. This is policy. I can love you and disagree with you. I mean, and that's something, that I learned in my own home. My father's my daddy, not my dictator. People are like, oh my goodness, when your father hears what you have to say, I said, my father's going to love me like he has always loved me, and you never going to beat him loving me. Trust and believe, and I know this. All he's ever asked me to do was present a cogent argument. Make your case. Because see, that's what we would do around the dining room table in the Jackson house. We would have debates for fun, and that's what we do for the holidays. And we put on a trial every. We do that, and it's big fun.
That's great.
Oh yeah. It's always big fun, and we used to get dressed up, and play. I was LaToya Jackson one year. I mean, just a whole bit. Well, I did my best. But this is where we have to do this. But I have someone that I have you that I could bring into this space and give us all of this great information, because goodness knows you're brilliant, and I think you're principled more than that, or you're at least as principled as you are brilliant, steeled in godly principles, and I just appreciate that more than I can tell you. I really, really do. So let me know when you have some more time in the next few days because I would love to have you back on to have, we got some conversations to have a ton. We really do.
Sounds good to me.
You let
Sounds
me
good.
know. You
Thanks
let
for
me
having
know.
me always.
Oh, please. I love you. My love to the family. Everybody, the Creating Opportunity Conference, Rainbow Push, please, please, please go on and get registered. It's free. It's free. But we would like for you to join Rainbow Push because it's not free for us. We have to pay to put it on. But Reverend Jackson wants that to be his gift to you so that you can have the opportunities. There is a way for you to make it in this critical time in history. And go to the Creating Opportunity Conference. It begins tomorrow. As soon as I get off the air, go to rainbowpush.org, go to the Rainbow Push Atlanta website, go to either of those places and register for the conference. Please do. Go on and register, everybody. I love you, love you, love you, love you, love you. No, we're not going to do one of our holiday debates on Facebook Live. No. It's just it's just our family fun, girl. Oh no. But you can come on over to the house. Uh-huh. Come on over to the house after you're in Chicago, Lorraine. Y'all come on over. We'll do something like that. I love you, everybody. See you tomorrow on the Santita Jackson Show.